Welcome to the Anxious Child Podcast, the podcast that helps you best work with anxious kids and teens. Now, here's your host, Stephen Quinlan.
Hey everyone, welcome to the show. Today I'm super excited to announce that we have Dr. Nicholas Mian, who is a professor of psychology at the University of New Hampshire at Manchester, here to talk to us today about the importance of early intervention with kids who have anxiety. Dr. Mian has focused much of his research over the years on understanding anxiety in young children in particular. He's made efforts both around designing and implementing effective early intervention and prevention programs, and he's also an advocate for applied learning. His students participate in his research by working directly with the kids and parents and giving them practical experience in real-life scenarios. As you'll see, I think in the interview today, Dr. Mian is very focused on also giving parents the skills to help anxious kids navigate what can be oftentimes a very difficult world. And he is a big proponent of helping them to help the kids be able to work through that anxiety so that they're not stuck in that place. It's also very interesting to learn about the importance of working with really young kids and getting kind of a jump start on this. As we know that early intervention is important in many things such as autism, etc., but I feel like this gets kind of glossed over when we're talking about really young, anxious kids because it can be hard to tease out what's sort of a clinical issue at that young age and what might be just more being that age. So luckily enough, we have Dr. Mian here today to help us distinguish that and also understand why it is so important to get in there early and what the improved outcomes are as a result of doing that. So really quick before we get to the interview, I am super excited to announce that I have a new program that's going to be kicking off probably around February that I've kind of alluded to in some past episodes. I can let you know that this is going to be focused on well-being for therapists and how to help therapists best be able to continue the work that they're doing right now, which is so important. As we know, there is a shortage of mental health services, and part of that, I think, is a result of therapists and mental health clinics just being overwhelmed as there's so much need right now. And so I felt like there's really a need for therapists to take care of themselves so that they can continue to help people. So that's what a lot of this program is going to be focusing on. I don't have obviously all the details yet as that's being sorted out behind the scenes here, but that is what we're looking at, hopefully coming out around February. So for now, let's enjoy learning all about early intervention and childhood anxiety with our special guest, Dr. Nicholas Mian. Enjoy. Well, welcome. Thank you so much for being here. Really appreciate it.
Thank you for having me.
I was noticing on your bio that you are a Lord of the Rings fan, which I thought was interesting. I'm currently reading The Lord of the Rings to my 11-year-old. We made it through The Hobbit, and now we're reading sort of out loud the first book. So I was thinking about that in relation to anxiety and how there are kind of these parables of like the ring itself, and you put it on and then you get this like temporary escape. But, meanwhile, you're being sort of taken over by this sinister force.
Yeah.
What do you think about that?
A lot of big topics there.
Yeah.
Yeah. That's funny. I read The Hobbit with my two kids who are 8 and 11.
Oh, nice.
And then I was like, okay, we read The Hobbit. We're not going to read The Lord of the Rings. I just don't have that in me. Too
Yes.
long, too complex. The Council of Elrond. I think we go too much over their head.
Yeah.
But we ended up watching all the movies together, which was a lot of fun.
Yeah. I am now maybe regretting that decision that I made being about 350 pages into the fellowship. But The Hobbit is great because it, is designed as a children's book and it's kind of aimed at younger children, which, is a lot of what we're going to be talking about today. And your work with anxiety in young kids and prevention and all that sort of stuff. So I'd love to dive into that. Can you tell me about anxiety in really young kids in particular? Like what does that look like? What should people have kind of an eye out for?
Yeah, it's a good question. Typically when we talk about mental health, behavioral health in children, most people don't really think about really young kids and what that looks like. But the research really supports that most emotional conditions can be traced back to pretty early in childhood. And in fact, in my graduate work, we were even collecting parent-based data on emotional behavioral difficulties in kids as young as 1 and 2 years old. So it is possible to screen for these things and identify them in kids as, at ages 3, 4, 5, 6. That's kind of what I think of as preschool age.
Mm-hmm.
For anxiety, it's a lot of the kinds of things that a lot of people are quick to dismiss as like, oh, that's just typical for a young child. So kids who are very afraid of certain things, so specific phobias, fears of clowns, of certain animals, fears of certain situations are very prevalent in preschool age kids. And, most of the time it's not a big deal. If the kid has a very severe phobia, maybe after 5 or 6 months it goes away or it ceases to be as interfering. But for some kids, it doesn't go away. It can even get worse, or it can kind of almost morph into something else. So a kid who at age 5 is afraid of clowns, maybe at age 8, they're afraid of social performance situations or something like that. And of course, we know anxiety is somewhat temperamental. So certain kids are more likely to struggle with anxiety. So phobias are a big one. The other ones you'd see a lot of is separation anxiety.
Mm-hmm.
Separation anxiety, again, looks very different at different ages. When you see a kid who can't separate from their parents at age 11 or 12, it's a clear red flag to most people. The same behavior in a 4 or 5-year-old, many people would be quick to say, oh, that's just, because they're a little kid and that's normal. But I think it's worth remembering that even at age 4 or 5, having that much difficulty separating from your parents can be quite impairing.
Mm-hmm.
And, I think what we're going to be getting into in our talk today is about how, sometimes we really have to notice those things and take them seriously, because it can be an opportunity for early intervention. It could be a good thing in the long run.
Yeah. So when it's funny, you were talking about clowns, I was like, I feel like everybody's afraid of clowns. Like in some way, this is why Stephen King writes about, what he does. But how do you distinguish then if, say, you're either a parent or a clinician and you see a child who has either a specific phobia of some kind or the separation anxiety, like you mentioned, how do you gauge where that is on the sort of quote unquote normal developmental behavioral scale?
So I developed a training for pediatric residents. So pediatricians in training, basically, a couple of years ago. And we developed quick way to do this. Think about it, pediatrician only has like 2 minutes basically to screen for emotional conditions. So it had to be really quick and precise. What we came up with is FDDI: frequency, duration, distress, and interference. Frequency is how often it happens. So even if a kid has a really severe anxiety reaction to a situation, if they only encounter that situation once a year, it's probably not the deal. But if it's happening on a weekly basis or even more often, that's going to cause more concern.
Mm-hmm.
Duration, so how long has it been going on? So if it's only been going on for a month or so, then it might be, like I was saying earlier, just kind of a phase. But if it's been going on for more than 6 months, it's probably more likely something that's not just a quick kind of transient thing.
Mm-hmm.
Distress is how much emotional discomfort it causes for kids. I'm sure many of the listeners of this podcast are well aware that anxiety can be extremely distressing and uncomfortable for kids. So if it's, and that's usually pretty easy to gauge if you're a parent, but if you're like a pediatrician or someone else who doesn't see the child in those situations, it's important to really ask about that.
Okay.
And then the last one, I think many people would say is probably the most important, is the degree of interference or impairment, right? How much does it get in the way of the child being able to do things that a typical kid their age ought to be able to do, going to play dates, going to school without it being a terrifying experience, going to the doctor, going to the dentist, those kinds of situations that we consider to be kind of like normal aspects of kind of the childhood experience. So so that FDDI might be helpful for folks to just kind of think about. And I don't use that as like, oh, well, these kids are high risk and these kids are low risk, but more just a way to kind of think about, should I be paying more attention to this? Should I be maybe like getting a second opinion, et cetera?
Okay. Yeah, that makes a lot of sense. And so then once we've established that there is something that meets those criteria in some way, I know you're a big advocate of early intervention and prevention. Can you describe, first of all, what that is? And then I guess, secondly, kind of what the rationale is behind it?
Yeah. So I think to answer the first question, what it is, when I say prevention of anxiety disorders, what I'm talking about is intervening in such a way that the disorder never actually develops. That's the idea. So that it's basically heading it off before it becomes highly impairing. And there's lots of different ways that we can do that. We could talk about. As far as the rationale goes, the way I like to think about it is comparing mental health treatment to dental treatment, right? So I was at a conference years ago, and some of the most important researchers in clinical interventions for anxiety disorders started talking about this notion that we need to think about emotional health in the same way we think about dental health. So if you think about that, so pretty much every kid in the United States, except for some kids who might not have access to care, every kid pretty much goes to the dentist at least once a year. And the purpose of that is there's multiple reasons for it. First of all, you get a regular cleaning, it prevents serious disease, right? It's preventative in that it's sort of an ongoing, regular, deep clean of your teeth, which is good for oral hygiene. It also prevents problems from getting really bad because it's like a screening tool, right? So, so every time the dentist or the hygienist is looking in your mouth, they're looking for signs that something might be developing. And then the third thing, which I think is really important, is that because of this, it is a normal childhood experience to go to the dentist for every kid, right? So it's not weird to go to the dentist. Parents don't feel uncomfortable about sending their kid to the dentist. It's not stigmatizing to go to the dentist. It's just a normal thing. If we talk about the way we approach mental health care for children, it would be the equivalent of only going to the dentist after you have severe gum disease, right? It's like only after nothing else has worked and you're at the end of your rope and, maybe your child can't go to school or, like there's serious impairments in place. And only then do most families reach out for treatment. So just, I think it's useful maybe to just stop and think about what would that look like if every kid could meet with a counselor for like a regular checkup. Typically developing kids with no apparent problems, just a regular checkup to kind of check in, see how things are going. It would provide an opportunity to identify problems before they get really bad. And it would, importantly, I think, destigmatize the process of talking to a counselor. So I think there's a lot of potential opportunities there. Obviously, there's a lot of barriers too. But that's the way I think about prevention, is this notion of it really reaching kids before they develop problems.
I love the sound of that. And I really like the idea of the destigmatizing, which fortunately is happening somewhat a little bit already, just in a broad cultural, societal way. But it's true that if we wait until there's like a 4-alarm fire going off before we're doing anything about these issues, at which point they may also be more ingrained and just behaviorally, like you've been doing that for so long, is harder to break out of at that point.
Yeah, that's the way I think about it is, sort of like these behaviors become habitual for the kids. Avoiding certain things because they're anxiety provoking becomes habitual for the kids. And then the parents and teachers and other adults in the child's life also get used to accommodating certain things because they know it's anxiety provoking. So they accommodate and kind of adjust the child's life around those things. And it eventually becomes normal.
Mm-hmm.
So yeah, I agree.
Yeah. So talk to me then about when you have a young child that has been sort of identified in this way. Unfortunately, this is, the system that we're working in, right? And they come in for early intervention. What does that look like for them? I know you do some kind of interesting things is it video trainings?
Well, so the video-based training, I think what you're getting at was the training that I had developed for a pediatric residents I was talking about.
I see. Okay.
So, but generally speaking, when we're talking about early intervention or prevention programs for preschool age kids, it's mostly parent-based work.
Mm-hmm.
Most of the interventions, at least the evidence-based programs, are working with parents basically to almost give the parents skills so that they can be the child's therapist and so that they can be looking out for signs of anxiety, how to respond to anxiety, and how to essentially nip avoidance in the bud. Because that's kind of what I think of as sort of the slippery slope toward significant anxiety is when you avoid things and then avoid more things and then avoid more things. And you essentially lose the ability to tolerate so many anxious emotions in so many situations.
Mm-hmm.
And if parents are able to identify that and nip it in the bud and understand the rationale for that, that's typically the way these programs work. There are some programs that work directly with kids too. Those I think of as more on the sort of early intervention side of the spectrum. So rather than, as opposed to getting to kids before they develop problems, it's getting to kids who already have problems, but they're not as bad as they might be if they don't get intervention, if that makes sense. It's a whole spectrum.
Yeah. Okay. So on the one side, you've got the parent training and helping them to try to not do what they may have been doing in a very well-meaning way in order to protect their child from these uncomfortable feelings or situations. And then there are also some kids who would they be, I guess, working with like a therapist or a counselor at that point in the one-on-one?
Mm-hmm. Yeah.
Okay.
Yeah. Either one-on-one with just a counselor and child or with the parent in the room as well. Pretty common for that, especially for anxious kids. Who might actually, with separation anxiety, for example, might not be able to meet with just a counselor.
Right. Yeah. Okay. So does that cover sort of the various types of prevention programs that you do?
Well, so the various programs that are out there, I wonder, it would be useful maybe to talk about kind of that spectrum that
just more generally outside of what you're doing.
Yeah, exactly.
Okay.
So there's three essentially types of prevention programs. And this isn't specific to mental health. It's used throughout kind of the healthcare theory, I suppose. So on the one hand, you have universal prevention, which is for everyone. So universal prevention is you just try to reach as many people as possible. And a common example of that is like anti-smoking advertisements on TV or anti-smoking billboards that you might see on the highway. Those programs aren't targeting specific populations, it's targeting everyone. And universal programs tend to be kind of low cost, non-invasive, basically. And then the next one is selective. So you got universal, selective, and indicated. Selective is targeting individuals who have not yet developed a particular condition, but they have risk factors or they are at risk for developing that. So an example of this would be doing like breast cancer screening for women who are at risk of developing breast cancer due to family history, for example. So here it's kind of in the middle where you're targeting individuals who are, again, haven't yet developed serious symptoms, but they have risk factors. And then finally, indicated is kind of what I think of as early intervention. You're targeting those who have started to develop early signs or symptoms of the condition, but they haven't developed kind of a severe case yet. Mm-hmm. So an example of that is like intervening with teens who might be using substances, might be exploring substances, but they haven't gotten to the point where they've developed an addiction yet. Mm-hmm. And if we think about that spectrum, you can kind of think about how interventions for anxiety disorders might fall into different categories. So like meeting with a therapist for a preschool-aged child who's developing some pretty significant anxiety, it would be much closer to the sort of the indicated side of things. If we're just sort of trying to spread the word and disseminate ideas about, social emotional parenting and how to be a parent that supports healthy social emotional learning, that would be more on the universal side of things. And then there are programs specifically for anxiety that fall into the selective prevention umbrella.
Mm-hmm. What is the research telling us about early intervention, and I would imagine at this point, and maybe you've even, I don't know, been able to see this just almost sort of generally in your work, how important is it to get in there in those early stages for anxiety disorders? I feel like we know this about things like autism, but what is it telling us, if anything, about the importance of that? And do we have any like differing outcomes and studies of that nature that you know of?
Yeah. So I think if you spoke to most clinicians who work with childhood anxiety disorders, I think most would say it's always easier to intervene on the earlier side of things. Yeah. Like we were saying earlier, right? Before things become really entrenched. Mm-hmm. And that's actually one of the strongest arguments for early intervention, because it's easier to make change. It's easier to adjust family behaviors before things become really entrenched and habitual, like we were saying earlier. Mm-hmm. And the research supports this. So it's pretty clear in the research that if we have kids who have anxiety disorders or even like disruptive behavior disorders in early childhood, those kids are at much, much higher risk to have serious psychopathology later on in their childhood, in their adolescence, and in early adulthood. In fact, Ron Kessler, who's a famous epidemiologist, sometimes will use the term gateway disorders to talk about preschool age anxiety disorders, and even things that might seem as benign as like a specific phobia in a preschool age kids almost are gateways into much more significant disorders down the road. So early intervention is very much supported in the research. I'm working on a meta-analysis right now, which is basically a research study on research studies that have been done in this area. And the results are pretty compelling that early intervention and prevention programs work for young kids. As you might imagine, it's hard to do really long-term studies. It would be great if we followed these kids for 5, 10, 15 years. Those studies are really difficult to do. But the limited research we have out there implies that they do have lasting effects.
And kind of hearkening back to what we were talking about earlier and your analogy of the dentist and destigmatizing that sort of going to a counselor and mental health in general, I think it's important to mention that if your child is displaying some phobia or something like that you're concerned about, that you try not to get wrapped up in your own anxiety and start fast forwarding down the road to, as you said, we have this gateway of, oh my gosh, this, now they're going to be schizophrenic or something like that. Yeah. But you can go to a counselor, and it's kind of no harm done, right? Like, especially if they're young, they play with the counselor, it's fun, and that's it.
Yeah, I think when I use terms like that and when I think about this, I'm thinking about this like a researcher who's looking at a data set of, 1,000 kids or something, right?
Yeah. Yeah.
You can't say, okay, well, at the mean level, this is what we find, and therefore that's what every individual person should do, right?
Mm-hmm.
So every individual parent, of course, has to make those decisions for themselves. And of course, these programs don't work for everyone, just like psychotherapy and counseling doesn't
Mm-hmm.
work for everyone,
Mm-hmm.
or a particular approach won't. So yeah, I think that point is very well taken. But like you're saying, this is a case where you're not likely going to do any harm
Right.
to a child engaging in psychotherapy. I mean, of course, I'm not a fan of taking kids to therapy for years and years who don't need it, right?
Mm-hmm.
They probably have better things to do with their time.
Sure.
But yeah, for an evaluation or a check-in or just maybe a consultation, and sometimes, and I do that too. I'll do a consultation just with the parents to just
Mm-hmm.
talk about what's going on and whether I think it sounds like this is something they could probably just manage on their own with a few tips,
Mm-hmm.
or is this something that where they should really be reaching out to professional help?
Yeah, it's almost like the only thing you have to, I don't even want to say lose, but I'm not sure what the other word for it is, I guess sort of hang on to, is your own worry and fear as a parent about what does this mean? Like, because we're going, like the kid, especially the young kid, like they don't care. They don't really necessarily know what's happening even. So it's really more about that I could see as being like a preventative factor towards people going and having an evaluation of some kind.
Yeah, I was just going to say, some of the other work that I've done is on parent engagement in prevention programs. So this is the case actually for anxiety, but it's also the case for prevention programs for disruptive behavior disorders.
Mm.
The biggest limiting factor is not the efficacy of the programs, but how many parents will actually agree to participate.
Mm.
And I think what you were getting at there is this, parental attitudes about seeking help for their kids and seeking help for themselves, I think is really hard for a lot of parents.
Yeah, absolutely. And we know this about just people in general. I mean, even adults going into psychotherapy, right? There's that leap that you have to kind of get past of, I need to go get some help for something. And that can be really difficult. What are some of the other challenges that you see in doing early intervention? Is there anything kind of specific to doing that in the United States or sort of in this day and age? Or what does that look like?
It's funny that you say the United States, because it is the case that it seems like this country, we do a particularly bad job of early intervention and prevention. This isn't necessarily based on any research, but it's just kind of my impression looking at different programs that are happening in different parts of the world. Most of the published studies on prevention are done in other countries. Australia in particular, especially for anxiety disorders, seems to be like a hub of anxiety disorder prevention work. One of the advantages that a lot of other countries have, at least developed countries, that we don't have, is a public pre-K system.
Mm-hmm.
And that public pre-K provides a pretty perfect sort of intervention window, a way to reach these kids when they're young and they're all in the same place, and it can be funded by the federal government, et cetera, in some of these schools. So in the US, our mental health system is very much retroactive, focused on retroactive care, basically trying to treat problems that have already developed.
Mm-hmm.
And we do have school-based programs and social emotional curricula in schools, but again, it's generally for older kids. And I think a lot of folks on the mental health side of things would say, I think there's more that could be done there.
Mm.
And again, I think the last thing is just kind of a cultural shift that would need to happen. When I talk about the notion of treating mental health care more like we treat dental care, for that to happen, and that's sort of like a utopian concept.
Yeah,
right?
I was thinking that. Yeah, it sounds great. Yeah,
it sounds great, but like the number of barriers and things that it would take in order for something like that to happen in the United States are pretty significant.
Mm-hmm.
And one of them, I think, is a cultural shift, a cultural shift that recognizes the importance of early intervention, the importance of mental health care in general, and prioritizes it, especially in young childhood.
Yeah, I'm hopeful in some ways. I feel like, I mean, it's not seismic change, but there is, as we were kind of alluding to earlier, there is a little bit of that shift in terms of obviously the stigma, like we mentioned, and I think prioritization of mental health in general. And I also think you see a little bit of this happening even in medical care in terms of looking more at proactive things instead of these reactive things, which, as you said, were essentially we're just, we're putting band-aids on symptoms of things that are cropping up from long-term habits or what have you.
Yeah, I think, again, to go back to the dental care analogy, the reason why insurance companies pay for regular checkups is because they're cheaper
right,
than really invasive procedures.
right.
And I would argue the same principle is true in mental health.
Uh-huh.
And in fact, this case is made, if you think about kids with disruptive behavior disorders, for example, that if you can get 50 parents to participate in a prevention program these programs teach things like effective discipline and effective engagement with kids. And it's basically to try to nip disruptive behaviors and things like aggression and noncompliance in the bud before they get real serious. These are disorders with really significant consequences for kids, getting expelled from, daycares or early childhood, but then if these problems don't get addressed, getting expelled from school. And then we have, of course, this school to prison pipeline for kids, So these programs will actually talk about, if 50 parents participate in this program, if we can just prevent one kid from getting expelled from school or from getting into the juvenile justice system, that's a huge money saver. And if you think about for emotional disorders, think about what highly invasive and expensive treatment looks like. Inpatient or partial hospitalization programs for teenagers, kids who go down the path of self-injury and all the different interventions that'll be required for that, and eating disorders. These are really difficult and expensive conditions to treat. I would argue that I don't know if anyone's really done too much of analysis on this. I've read some stuff about it, but I would argue that, insurance companies ought to be looking at preventive approaches to mental health care a little more seriously.
Yeah, I feel like there is some of that happening, and you would think, being in the capitalistic society that we live in, that the bottom line would carry that weight. And maybe that's where some of this shift will start to come from, is just in terms of efficacy and just expense, really, that it does make the most sense to do that. I'm curious also your thoughts around sort of, as we're talking about the current climate of things, what things have been like in the pandemic. I know there was one article where you talked a little bit about you being a parent and your own struggles of working from home and homeschooling the kids and all that sort of things. And how do you see that playing out right now?
Yeah, it's funny. I think you're getting at something. I think I published this. This is something in the Boston Globe magazine about how great it is that my kids are so bored.
Yes,
and basically, it's this just kind of like a personal thing of mine is that I sometimes do wish that kids just had more time to just do nothing, basically.
Right. Yeah.
And that there's benefit to that, to being bored and not having their whole lives very scheduled. And the pandemic provided that, and it's sort of a silver lining for me. I think it's worth noting. I think I wrote that like 2 months into the pandemic. So
okay.
maybe if I wrote it last month, I might feel differently.
Right.
Because my kids were homeschooled for an entire year. And that was extremely challenging.
Yeah, for sure.
I think at the high up level, I don't think homeschooling was good for kids for that long, to put it very bluntly.
Sure. Yeah.
Of course, there are benefits. I think parents spending more time with their children there's going to be benefit from that. Absolutely. Just understanding their kids better, getting better at being able to talk to their children, essentially being forced to have better methods or more effective interventions for behavioral control and discipline at home because they had to.
Right.
just to get through the day. So I think there will be benefits, but oh man, I think it's been really hard. And I know that the little bit of research that I've seen does imply that kids' emotional disorders, the prevalence is up for sure, especially in older kids.
Yeah. Well, it'll be interesting to see as more time goes on and more research starts to come out, what the effects are on both sides of the coin. Because as you said, I think there were some really positive things that came out of it for some people, and obviously a lot of struggles that went along with it. And it feels like right now we're, in the fall of 2021 at this transitional period of a lot of kids have gone back to school and trying to sort of emulate more of that quote unquote normal routine, but it's also not normal at the same time. So we're in this weird kind of in between place.
Yeah, it's weird. I mean, it's funny. Our kids or my kids anyway, they're back in school, attending school fully in person, after school programs and everything. And I'm tempted to say, oh, it's normal, but it's not. They're still wearing masks all day.
Yep.
So it's like our definition of normal has even shifted.
Yeah. And they're not used to it anymore. It's not, it just like how a lot of people are not necessarily wanting to go back to their jobs. I think there are a lot of kids that are like, oh, wait a minute. Like there's some things that I really don't necessarily like about this. And I would imagine, just kind of anecdotally, I think even kids especially kids who have anxiety are like, wait a minute, I was all holed up in my room and I didn't have to go anywhere. I mean, talking about avoidance of things. And that was great. And now I have to face this stuff, which is difficult in the short term, but as we know, in the long term, we'll be better off for them.
Yeah. I think that's a really important point. When I talk to parents and they're like, oh, well, what should I do to try to prevent anxiety in my kids? It's kind of the one thing that if you could boil it down to one thing, I sort of hinting at this earlier, it's essentially not encouraging avoidance. So a lot of times parents their kids are going to avoid the things that they're anxious about, but it's when the parents encourage the avoidance that I think is where you can get yourself into trouble. And the way that I frame this for parents, I used to use softer language. Then I've gotten a little bolder as I've gotten more experience. I'll tell parents, when you protect a child or remove a child from an anxiety-provoking situation, you're depriving them of an opportunity to learn how to cope with that situation, right? Because they're not going to learn how to cope with that by you telling them how to cope with it. They need to practice. They need to do it. I can tell a quick anecdote about my daughter. One of my daughters struggles a bit with anxiety, and she was at a sleepover a couple nights ago at a friend's house where she had never done a sleepover before. And right around, 8:30 p.m., I got the call.
You got the call? Yeah.
Like, please come get me. I can't do this. I'm too scared. And we were on the phone for, 10 or 15 minutes. And I was talking her through all the strategies that we've worked on developing, and deep breathing and coping thoughts and all this other stuff. And then eventually I just said, okay, so now you have to hang up because I'm not coming to get you. And she was like, no, I'm not going to hang up. And I was like, well, if you don't hang up, I'm going to hang up. So, and she certainly preferred to hang up herself. So she did. And she went to sleep. And I talked to her the next day about it. And I said, now, what would it have been like if I actually went and picked you up? And we had this whole conversation, and she talked about how she would have been so disappointed in herself, and she would have been so down and frustrated. And instead she was feeling like, I was glad I got through it. And this is after she spent, 15 minutes begging me to come get her. Right. But she had the insight the next day to be able to see that actually me not getting her was the right thing. And I thought that was it was reassuring for me.
Yeah,
it was
like,
also
good.
I think it's a lesson for parents sometimes, that in the moment it can be so hard, but if you think about it and reframe it as the child needs to practice this, they need to go through these emotions, that sometimes can make it a little bit easier, or parents can kind of rationalize that. If you might call it tough love or whatever, it's giving the child an opportunity to experience these difficult emotions.
It's interesting because I didn't hear her say in there, and maybe she said this and you just didn't mention it, but I kind of doubt it. Dad, I felt like you abandoned me, or I felt like that you had sort of left me, and I was upset by that, which I would think as a parent, like that's what you're worried about, right? Is that,
Yeah, she didn't, and I don't think she ever felt that way.
Yeah.
And I think perhaps that maybe I'm giving myself too much credit here, but I would like to think that that's a reflection of the fact that we've talked about this a fair amount, right? Like, it's important for you to have these experiences. And my wife and I are on the same page, and she's on the same page. And we all know that this is something we're working on, and it's hard. And anxiety is extremely uncomfortable, but it's not dangerous, right? Just because you feel really anxious at the sleepover, it doesn't mean you're in danger. You're totally safe. And it's going to be okay. And it's going to be fun the next morning when you wake up and have pancakes or whatever, so I think that's important for parents to hear, right? That kids aren't necessarily going to jump to this conclusion that you've abandoned them or you've traumatized them in some way. That sometimes it's, if you're able to talk about it enough that you're on the same page and you both understand this is something, a skill that you as a parent are helping your child to develop.
And you're giving them the reasons why it is that you're doing what you're doing, so that they understand that it's, for their benefit, and to help them kind of work through that. That makes a lot of sense.
Yeah. And not every kid is going to be quite as understanding.
Right. Sure.
But I do think it's a useful exercise for parents to think about, when they're in a similar situation. Sometimes I frame it as, are you helping out your child here because your child needs it? Or are you helping out your child because it's too difficult for you to see them with experiencing this much discomfort? So sometimes it's teaching the parents to tolerate their own distress in their awareness of their child's distress, because that's really hard as a parent, right? I mean, we're essentially hardwired to try to protect our kids.
Yeah, absolutely. And it's what's happening with the kids is they're hardwired to experience anxiety in certain situations, right? I mean, you can't help that your amygdala is firing off, and like, that's just, it happens. Yeah. I've so many times before about the kids that they're a mirror, they hold this thing up for you that you can look at and try to understand what it is that you have to work on about yourself in order to what you as a hardwired parent want to do, which is be the best parent for them that you can. So I think that's a great reminder of that. Thank you so much for being here today and for talking to us about this. I think it's really important, and I overlooked a lot of times about the younger kids, because I do think there is that sense of you kind of wave it off and they're little, but hopefully we'll get to this utopian society someday of where everybody goes to the dentist and everybody gets mental health evaluations, and it'll be great.
Great. Well, thank you again for having me on. This was fun.
All right, that was Dr. Nicholas Mian. You can check him out on the Manchester University of New Hampshire website. He has a long list of publications and research that he's been involved in if you want to check that out further. But we really appreciate his time and insight and for joining us today. So that's it for today. And until next time, be well and be in touch.
This podcast is not intended as medical or psychological treatment. In no way should it replace treatment from a mental health professional.